Medical Assistant Exam Practice Questions. Question 1. During a walk-in visit, a patient with diabetes is involved when a blood specimen arrives hemolyzed after collection. Which practice helps prevent this problem? Option A. Force blood through a small needle into the tube. Option B. Gently invert tubes according to additive requirements. Option C. Use excessive suction on fragile veins. Option D. Shake tubes vigorously to mix faster. The correct answer is option B. Gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 2. During a skills check, the scenario states that a patient scheduled for a fasting lipid panel says they ate breakfast after noticing a potential safety concern. Which action is best? Option A. Collect and label it fasting anyway. Option B. Cancel all future appointments. Option C. Follow facility policy and notify the provider or lab before collecting if fasting is required. Option D. Tell the patient to skip water for the rest of the day. The correct answer is option C. Follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 3. A provider asks for assistance because a urine culture is ordered for a patient with possible infection for a patient with a routine complaint. Which instruction is appropriate? Option A. Touch the inside of the lid to keep it nearby. Option B. Clean the area and collect a midstream specimen in the sterile container. Option C. Collect from the toilet bowl after voiding. Option D. Fill the container with water before collecting urine. The correct answer is option B. Clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 4. For a patient in the exam room in an outpatient setting, a point-of-care test control result is outside the acceptable range. Which action should occur before testing patients? Option A. Throw away the control log. Option B. Do not report patient results until the control problem is resolved. Option C. Continue testing because controls are optional. Option D. Change patient results to match expectations. The correct answer is option B. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 5. Before the provider enters the room, a patient misses a scheduled appointment without canceling while maintaining privacy. Which action is appropriate? Option A. Document the no-show and follow office policy for follow-up. Option B. Discuss the patient publicly in the waiting room. Option C. Bill any random amount without policy. Option D. Delete the appointment from the record. The correct answer is option A. Document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 6. After confirming the patient's identity, a finger stick specimen is being collected for a patient with diabetes. Which step is commonly performed after puncture? Option A. Wipe away the first drop of blood if required by the test procedure. Option B. Bandage before collecting the specimen. Option C. Touch the collection device to the skin surface repeatedly. Option D. Squeeze the finger forcefully until tissue fluid appears. The correct answer is option A. Wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 7. For a pediatric patient in an outpatient setting, specimens need to be spun in a centrifuge. Which safety step is required? Option A. Open the lid while the rotor is moving. Option B. Place tubes at random angles. Option C. Spin a single tube alone for faster results. Option D, balance tubes of similar size and volume across from each other. The correct answer is option D, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 8. For an older adult in an outpatient setting, blood cultures are being collected before documentation is completed. Which step is especially important? Option A, use proper skin antisepsis and avoid contaminating the cleaned site. Option B, draw through visibly dirty skin. Option C, palpate the site again with an unclean glove after cleaning. Option D, skip antisepsis because culture bottles contain additives. The correct answer is option A, use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 9. Before documenting in the chart, a patient in the exam room is involved when a patient takes several products for cold symptoms and pain. Which concern should be reviewed with acetaminophen? Option A, it always causes bacterial resistance. Option B, it replaces all vaccines. Option C, it should be taken only by injection. Option D, accidental duplicate dosing can increase liver injury risk. The correct answer is option D, accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 10. At a new patient intake, a chest lead is being placed during a 12-lead EKG after the patient asks a follow-up question. Where should V2 be positioned? Option A, right lower abdomen. Option B, fourth intercostal space at the right sternal border. Option C, fourth intercostal space at the left sternal border. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option C, fourth intercostal space at the left sternal border. V2 belongs at the fourth intercostal space on the left sternal border. Right sternal placement is V1, fifth intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 11. In a medical assistant certification review scenario, an EKG tracing shows irregular spikes while the patient talks and moves for a patient asking for clarification. Which action should the medical assistant take? Option A, ignore the artifact and file the tracing. Option B, move electrodes randomly until spikes disappear. Option C, increase room noise so the patient relaxes. Option D, ask the patient to relax, remain still, and avoid talking during the recording. The correct answer is option D, ask the patient to relax, remain still, and avoid talking during the recording. Movement and muscle activity can create artifact that interferes with interpretation. Noise, random lead movement, or ignoring the artifact does not correct the signal problem. Question 12. A medical assistant reviews a case where a patient asks what a 12-lead EKG records. Which response is accurate? Option A, it directly measures lung volume. Option B, it records electrical activity of the heart from multiple views. Option C, it measures blood glucose through the skin. Option D, it injects dye into the coronary arteries. The correct answer is option B, it records electrical activity of the heart from multiple views. A 12-lead EKG displays the heart's electrical activity from different lead perspectives. It is not a glucose test, pulmonary function test, or invasive dye study. Question 13. During a walk-in visit, a returning patient is involved when a patient reports new chest pain while an EKG is being recorded after the patient asks a follow-up question. Which action should the medical assistant take? Option A, erase the tracing because pain changes results. Option B, finish filing old charts before reporting. Option C, notify the provider immediately according to emergency protocol. Option D, tell the patient to drive home and rest. The correct answer is option C, notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 14. A provider asks for assistance because a cold pack is applied for a minor injury as ordered for a patient with limited mobility. Which safety instruction is important? Option A. Apply ice directly until the skin turns white. Option B. Place a barrier between the cold pack and skin and monitor the area. Option C. Use heat at the same time on the same site. Option D. Leave it on for several hours unattended. The correct answer is option B. Place a barrier between the cold pack and skin and monitor the area. A barrier and monitoring reduce the risk of tissue injury from cold exposure. Direct prolonged ice, unattended use, or combining heat and cold inappropriately can harm the skin. Question 15. During a geriatric visit, a teen patient is involved when the EKG pattern looks unusual and limb lead placement may have been reversed before documentation is completed. Which action is appropriate? Option A. Remove the patient's identification label. Option B. Submit it without comment because lead placement never matters. Option C. Change the printed rhythm interpretation manually. Option D. Check lead placement before repeating or submitting the tracing. The correct answer is option D. Check lead placement before repeating or submitting the tracing. Incorrect lead placement can produce misleading tracings, so verifying lead location is part of quality practice. Submitting without checking, removing identification, or altering interpretation manually is unsafe. Question 16. A medical assistant reviews a case where a patient preparing for a cardiac stress test asks what symptoms to report for a returning patient. Which symptom should be reported immediately? Option A. Preference for a different magazine. Option B. Chest pain, severe shortness of breath, dizziness, or feeling faint. Option C. Hunger after skipping breakfast. Option D. Mild boredom with waiting. The correct answer is option B. Chest pain, severe shortness of breath, dizziness, or feeling faint. Chest pain, severe dyspnea, dizziness, and faintness can signal serious exercise intolerance or cardiac stress. Boredom, reading preferences, and routine hunger may be addressed but are not the urgent stress test warning symptoms. Question 17. When preparing safe patient care, a clinic applies appointment policies fairly to all patients during a realistic certification question. Which ethical principle is reflected? Option A. Hemolysis. Option B. Tachycardia. Option C. Polyuria. Option D. Justice. The correct answer is option D. Justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 18. A medical assistant reviews a case where a tuberculin skin test is being administered for a teen patient. Which technique is appropriate? Option A. Inject deeply into the gluteal muscle. Option B. Massage the site hard after injection. Option C. Apply heat to spread the medication. Option D. Insert the needle shallowly with the bevel up to create a small wheal. The correct answer is option D. Insert the needle shallowly with the bevel up to create a small wheal. An intradermal test is placed just under the epidermis and should create a small wheal. Deep injection, massage, or heat can alter the test placement and interfere with reading. Question 19. During a skills check, the scenario states that a patient says they cannot swallow tablets safely while working under provider supervision. Which action is appropriate before giving an oral medication? Option A. Tell the patient to swallow it dry. Option B. Notify the provider and follow instructions before altering the medication. Option C. Crush every tablet automatically. Option D. Hide the tablet in food without consent. The correct answer is option B. Notify the provider and follow instructions before altering the medication. Some tablets should not be crushed or altered, so the provider or pharmacist guidance is needed. Automatic crushing, dry swallowing, or hiding medication can create safety and consent problems. Question 20. While following clinic policy, the medical assistant notes that a medication list includes atorvastatin for a patient who appears anxious. Which medication class does this represent? Option A. Diuretic used to increase urine output. Option B. Anticoagulant used to dissolve clots instantly. Option C. Statin used to lower cholesterol. Option D. A bronchodilator used for acute wheezing only. The correct answer is option C. Statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 21. While training a new medical assistant, a patient develops hives, wheezing, and throat tightness after an injection while preparing for provider review. Which emergency medication may be indicated by protocol? Option A, routine multivitamin. Option B, epinephrine. Option C, oral iron only. Option D, topical sunscreen. The correct answer is option B, epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 22. A medical assistant reviews a case where a handwritten order uses the abbreviation U for units for a teen patient. Which action is safest? Option A, clarify the order because you can be misread. Option B, change it to milligrams without asking. Option C, assume you means unlimited refills. Option D, ignore the abbreviation and give any dose. The correct answer is option A, clarify the order because you can be misread. The abbreviation you can be mistaken for a zero or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 23. After confirming the patient's identity, a patient uses a medication patch after the patient asks a follow-up question. Which instruction is important when applying a new patch? Option A, cut all patches to adjust the dose. Option B, cover the patch with a heating pad. Option C, apply every patch in the same irritated spot. Option D, remove the old patch before applying the new one if directed. The correct answer is option D, remove the old patch before applying the new one if directed. Removing the old patch prevents unintended extra dosing when the medication is delivered through the skin. Irritated sites, cutting patches, or adding heat may change absorption and increase adverse effects. Question 24. After confirming the patient's identity, an outside attorney requests a copy of a patient's medical record for a patient with a routine complaint. Which action is generally required before release? Option A, obtain a valid authorization or follow a permitted legal process. Option B, send the record because the attorney sounds official. Option C, give only verbal gossip about the visit. Option D, post the record in the portal without checking identity. The correct answer is option A, obtain a valid authorization or follow a permitted legal process. Medical records generally require patient authorization or a valid legal basis before disclosure. Official-sounding requests, unchecked portal release, and informal gossip violate confidentiality. Question 25. A medical assistant reviews a case where a provider describes a patient's heart rate as bradycardic while following standard precautions. What does this mean? Option A, faster than normal heart rate. Option B, slower than normal heart rate. Option C, absent breathing. Option D, high blood sugar. The correct answer is option B, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 26. When preparing safe patient care, a patient's blood glucose is described as hyperglycemic for a patient who appears anxious. What does the prefix hyper indicate? Option A, high or excessive. Option B, below normal. Option C, around the heart. Option D, without pain. The correct answer is option A, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 27. When preparing safe patient care, a chart lists hypertension as a chronic condition. Which finding is associated with this diagnosis? Option A, low body temperature. Option B, inflamed tonsils. Option C, low blood oxygen only. Option D, persistently elevated blood pressure. The correct answer is option D, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 28. When preparing safe patient care, a urine drug screen requires legal chain of custody handling during clinical workflow. Which action is essential? Option A, let the patient take the specimen home overnight. Option B, leave the specimen unlabeled in the bathroom. Option C, use a routine sticky note instead of required forms. Option D. Document specimen control and signatures at each transfer. The correct answer is option D. Document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 29. A provider asks for assistance because a patient asks which organ produces insulin for a patient in the exam room. Which organ should be identified? Option A, gallbladder. Option B, thyroid cartilage. Option C, pancreas. Option D, spleen. The correct answer is option C, pancreas. The pancreas contains cells that produce insulin for blood glucose regulation. The spleen, gallbladder, and thyroid cartilage do not produce insulin. Question 30. For a new patient in an outpatient setting, a medication note refers to hypotension during clinical workflow. What does hypo mean? Option A, between ribs. Option B, below normal or low. Option C, above normal. Option D, before birth. The correct answer is option B, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 31. A provider asks for assistance because a patient describes dysuria for a patient with hypertension. What does dys usually indicate? Option A, without. Option B, after meals. Option C, normal. Option D, difficult or painful. The correct answer is option D, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 32. A provider asks for assistance because the medical assistant needs to measure respirations after taking a pulse. Which technique is most appropriate? Option A, count only one breath and multiply by 60. Option B, tell the patient to breathe faster while counting. Option C, continue holding the wrist and count respirations without alerting the patient. Option D, ask the patient to hold their breath between counts. The correct answer is option C, continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 33. For a patient with diabetes in an outpatient setting, an anatomy diagram divides the body into left and right portions after reviewing the order. Which plane is shown? Option A, oblique medication route. Option B, transverse plane. Option C, sagittal plane. Option D, frontal plane. The correct answer is option C, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back, and oblique medication route is not an anatomical plane. Question 34. During a skills check, the scenario states that a patient is lying face down on the exam table for a patient who appears anxious. Which term describes this position? Option A, prone. Option B, Trendelenburg. Option C, supine. Option D, Fowler. The correct answer is option A, prone. Prone means lying face down. Supine is face up, Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 35. During a skills check, the scenario states that a patient has low hemoglobin and complains of fatigue after noticing a potential safety concern. Which condition is being described? Option A, anemia. Option B, dermatophyte infection. Option C, hypertension. Option D, appendicitis. The correct answer is option A, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 36. While following clinic policy, the medical assistant notes that a blood pressure reading is being prepared for an adult with a large upper arm for a patient with limited mobility. Which action supports the most accurate result? Option A, use the smallest cuff to keep it snug. Option B, deflate the cuff as rapidly as possible. Option C, place the cuff over the sleeve for comfort. Option D, select a cuff with a bladder size appropriate for the arm circumference. The correct answer is option D, select a cuff with a bladder size appropriate for the arm circumference. Correct cuff size keeps the pressure reading closer to the patient's true blood pressure because an undersized cuff can falsely elevate the value. Measuring over clothing, choosing equipment for convenience, or deflating too quickly can distort the reading and lead to poor clinical decisions. Question 37. After confirming the patient's identity, a patient's insurance requires approval to see a specialist while checking the chart. Which document or process may be needed? Option A, inventory count sheet. Option B, medication lot sticker. Option C, referral. Option D, autoclave log only. The correct answer is option C, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 38. During a skills check, the scenario states that a patient pays a fixed amount at each office visit under the insurance plan for an older adult. Which term describes this payment? Option A, premium refund. Option B, deductible only. Option C, copayment. Option D, relative value unit. The correct answer is option C, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 39. For a teen patient in an outpatient setting, an insurance plan pays 80% and the patient is responsible for 20% after the deductible. Which term describes the patient portion? Option A, coinsurance. Option B, chief complaint. Option C, sterilization. Option D, capitation only. The correct answer is option A, coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 40. After confirming the patient's identity, a disinfectant splashes into a staff member's eye after confirming office policy. Which first response is appropriate? Option A, flush the eye with water or eye wash for the recommended time and report the exposure. Option B, use hand sanitizer in the eye. Option C, rub the eye hard to remove chemical. Option D, cover it and wait until tomorrow. The correct answer is option A, flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 41. A medical assistant reviews a case where a medical office submits a professional paper claim for a pediatric patient. Which form is traditionally used? Option A, CMS 1500. Option B, growth chart. Option C, W-4 tax withholding form. Option D, fire extinguisher tag. The correct answer is option A, CMS 1500. The CMS 1500 is the standard paper professional claim form. Tax, safety, and growth documents are unrelated to claim submission. Question 42. While following clinic policy, the medical assistant notes that Medicare may not cover a service and the patient must be informed before it is performed. Which form may be needed? Option A, daily appointment reminder card. Option B, advance beneficiary notice. Option C, bloodborne pathogen log. Option D, pediatric growth chart. The correct answer is option B, advance beneficiary notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 43. At a community health clinic, a patient wants lab results through an online system while supporting safe patient care. Which feature supports secure access? Option A, a hallway bulletin board. Option B, a patient portal with identity verification and secure messaging. Option C, a public social media comment. Option D, a group text to unrelated patients. The correct answer is option B, a patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 44. After confirming the patient's identity, the provider blocks lunch, meetings, and procedure times before booking patients for a patient asking for clarification. Which scheduling method is being used? Option A, random scheduling. Option B, sterile scheduling only. Option C, matrix scheduling. Option D, biohazard scheduling. The correct answer is option C, matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 45. In a medical assistant certification review scenario, a patient misses a scheduled appointment without canceling while supporting safe patient care. Which action is appropriate? Option A, discuss the patient publicly in the waiting room. Option B, document the no-show and follow office policy for follow-up. Option C, delete the appointment from the record. Option D, bill any random amount without policy. The correct answer is option B, document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 46. In a busy family practice clinic, a patient requests correction of information in the medical record for a patient with hypertension. Which action is appropriate? Option A, erase the original entry without documentation. Option B, tell the patient records can never be reviewed. Option C, change another patient's chart instead. Option D, follow the facility process for an amendment or addendum. The correct answer is option D, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 47. A medical assistant reviews a case where a small contained fire is being addressed with a fire extinguisher after alarm procedures for a new patient. What does the first step in PASS mean? Option A, pour water first. Option B, push the patient. Option C, prepare billing forms. Option D, pull the pin. The correct answer is option D, pull the pin. PASS stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 48. When preparing safe patient care, a staff member fails to follow a safety policy and a patient is injured as a result after reviewing the order. Which concept is involved? Option A, therapeutic communication only. Option B, autoclaving. Option C, negligence. Option D, coinsurance. The correct answer is option C, negligence. Negligence involves a breach of duty that contributes to harm. Sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 49. After confirming the patient's identity, a patient uses a traditional health practice unfamiliar to the medical assistant for a patient with limited mobility. Which response is best? Option A, tell the patient to stop without provider input. Option B, ignore it even if it may affect care. Option C, ask respectful, non-judgmental questions and share relevant information with the provider. Option D, ridicule the practice in the chart. The correct answer is option C, ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 50. While following clinic policy, the medical assistant notes that a medical assistant wants to learn more about a symptom timeline before documentation is completed. Which prompt encourages a fuller answer? Option A, do not talk about the symptom. Option B, tell me when you first noticed the symptom and how it has changed. Option C, it started yesterday, right? Option D, you are fine now, correct? The correct answer is option B, tell me when you first noticed the symptom and how it has changed. Open-ended prompts let the patient provide a narrative and timeline in their own words. Leading or dismissive statements restrict the information and can bias the history. Question 51. In a medical assistant certification review scenario, a patient with limited English proficiency needs discharge teaching for a patient with a routine complaint. Which approach is best? Option A, speak louder in English only. Option B, use a qualified medical interpreter according to policy. Option C, ask a young child to interpret sensitive information. Option D, skip teaching because interpretation takes time. The correct answer is option B, use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 52. A medical assistant reviews a case where a vein tends to roll during palpation. Which action can improve venipuncture control? Option A. Ask the patient to pump the fist throughout the draw. Option B. Anchor the vein by pulling the skin taut below the site. Option C. Use the thumb above the puncture site. Option D. Tap the needle against the vein repeatedly. The correct answer is option B. Anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 53. After confirming the patient's identity, a medical assistant acts to promote the patient's welfare while following standard precautions. Which ethical principle is demonstrated? Option A, beneficence. Option B, fraud. Option C, deposition. Option D, a maleficence. The correct answer is option A, beneficence. Beneficence means acting for the benefit and welfare of the patient. Maleficence, fraud, and deposition describe harm, deception, or legal testimony rather than doing good. Question 54. In a medical assistant certification review scenario, a patient chooses between treatment options after receiving information for a teen patient. Which ethical principle is being respected? Option A, artifact. Option B, coinsurance. Option C, autonomy. Option D, sterility. The correct answer is option C, autonomy. Autonomy supports the patient's right to make informed decisions about care. Sterility, coinsurance, and artifact refer to infection control, insurance, and test quality issues. Question 55. While following clinic policy, the medical assistant notes that a patient becomes angry about a long wait after confirming office policy. Which response is best? Option A, mock the patient's concern. Option B, use a calm voice, acknowledge the frustration, and offer to check the status. Option C, argue loudly in front of other patients. Option D, threaten to cancel care immediately without policy. The correct answer is option B. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 56. At a preventive care appointment, a patient asking for clarification is involved when a patient is suspected of having active tuberculosis for a patient asking for clarification. Which precaution is most appropriate? Option A, use airborne precautions with appropriate respiratory protection. Option B, use only clean gloves. Option C, ask the patient to remove any mask to speak clearly. Option D, place the patient in the waiting room until closing. The correct answer is option A. Use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 57. A provider asks for assistance because a patient develops wheezing and facial swelling after a medication while maintaining privacy. Which response is appropriate? Option A, offer a glass of water only. Option B, activate emergency protocol and prepare to assist with ordered epinephrine. Option C, tell the patient to ignore throat symptoms. Option D, schedule a routine follow-up in 6 months. The correct answer is option B. Activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 58. During a skills check, the scenario states that a patient has a minor thermal burn from touching hot equipment for a patient asking for clarification. Which first aid action is appropriate? Option A, rub butter into the burn. Option B, cool the area with cool running water according to protocol. Option C, apply ice directly for a long time. Option D, break blisters to release fluid. The correct answer is option B, cool the area with cool running water according to protocol. Cooling a minor burn with cool running water can limit tissue damage and reduce pain. Direct prolonged ice, butter, or breaking blisters can damage tissue or increase infection risk. Question 59. During a skills check, the scenario states that a patient with shortness of breath is waiting to be evaluated while checking the chart. Which position may help breathing while waiting? Option A, Fowler position with the head of the bed elevated. Option B, prone position with the face down. Option C, Trendelenburg position with the head lowered. Option D, lithotomy position with feet in stirrups. The correct answer is option A, Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 60. A medical assistant reviews a case where an AED is available for an unresponsive patient with no normal breathing for a patient scheduled for a procedure. Which action is appropriate? Option A, place the pads over thick clothing. Option B, turn on the AED and follow its prompts while continuing emergency response. Option C, ignore the AED because it gives instructions. Option D, use the AED only after the clinic closes. The correct answer is option B, turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 61. For a patient with hypertension in an outpatient setting, a patient falls in the hallway and says their hip hurts after confirming office policy. Which action is appropriate? Option A, delete the event if no one saw it. Option B, tell the patient to walk it off. Option C, lift the patient quickly without assessment. Option D, keep the patient still, call for help, and follow incident protocol. The correct answer is option D, keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 62. A provider asks for assistance because a patient is scheduled for a minor office procedure for a returning patient. Which role may the medical assistant perform? Option A, perform the procedure without provider involvement. Option B, sign the consent for the patient. Option C, explain all surgical risks independently. Option D, witness the patient's signature after the provider obtains consent if office policy allows. The correct answer is option D, witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 63. During a follow-up visit, a 12-lead EKG is being set up. Where is lead V1 placed? Option A, 5th intercostal space at the left anterior axillary line. Option B, on the right wrist beside the limb lead. Option C, 2nd intercostal space at the left midclavicular line. Option D, a 4th intercostal space at the right sternal border. The correct answer is option D, 4th intercostal space at the right sternal border. V1 is placed at the 4th intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 64. At a pediatric visit, a patient has a small foreign material exposure in the eye while following standard precautions. Which action is appropriate before irrigation? Option A, check the order or protocol and use appropriate solution and protection. Option B, use a dry cotton swab across the cornea. Option C, apply random medication drops without order. Option D, ignore contact lenses and begin forcefully. The correct answer is option A, check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 65. At the front desk handoff, an adult patient is involved when a patient is using a nebulizer treatment in the office for an adult patient. Which instruction is appropriate? Option A. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Option B. Turn the machine off whenever mist appears. Option C. Drink the medication from the cup. Option D. Share the mouthpiece with another patient. The correct answer is option A. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 66. For a returning patient in an outpatient setting, a weak patient needs help stepping onto the scale. Which action supports safety? Option A. Pull the patient quickly by one arm. Option B. Use proper body mechanics and assistive devices according to the patient's needs. Option C. Leave the patient unattended on the scale. Option D. Ask another patient to help lift. The correct answer is option B. Use proper body mechanics and assistive devices according to the patient's needs. Safe transfer assistance uses body mechanics, assessment, and appropriate devices to prevent falls. Pulling, leaving the patient unattended, or asking another patient to lift creates safety risk. Question 67. While following clinic policy, the medical assistant notes that a laboratory specimen lacks patient identifiers after the patient asks a follow-up question. Which outcome is likely? Option A. The specimen may be rejected because identity cannot be verified. Option B. It should be processed under the nearest room number. Option C. It can be relabeled later from memory. Option D. It should be mixed with another specimen. The correct answer is option A. The specimen may be rejected because identity cannot be verified. Specimens without proper identifiers may be rejected to protect patient safety. Room number guessing, memory relabeling, or mixing specimens can lead to wrong results assigned to the wrong patient. Question 68. A provider asks for assistance because a patient reports a severe latex allergy before rooming for an older adult. Which action is appropriate? Option A. Ignore the report unless a rash is visible. Option B. Document the allergy only after the visit. Option C. Use powdered latex gloves for a better fit. Option D. Use latex-free supplies and alert the care team. The correct answer is option D. Use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 69. While following clinic policy, the medical assistant notes that a patient has been rushing and sits down for a routine blood pressure measurement while preparing for provider review. Which step should occur before recording the value? Option A. Record the value immediately to avoid delay. Option B. Place the arm above the head to relax the vessels. Option C. Ask the patient to stand for the first reading. Option D. Allow the patient to sit quietly with the arm supported at heart level. The correct answer is option D. Allow the patient to sit quietly with the arm supported at heart level. Resting quietly with the arm supported at heart level reduces temporary changes caused by activity and position. Standing unnecessarily, elevating the arm above the head, or recording immediately after exertion can make the reading unreliable. Question 70. When preparing safe patient care, the medical assistant needs to measure respirations after taking a pulse for a patient with limited mobility. Which technique is most appropriate? Option A. Ask the patient to hold their breath between counts. Option B. Count only one breath and multiply by 60. Option C. Tell the patient to breathe faster while counting. Option D. Continue holding the wrist and count respirations without alerting the patient. The correct answer is option D. Continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 71. When preparing safe patient care, a pulse oximeter is not giving a steady reading on a patient with cold fingers. Which action should the medical assistant try first? Option A, place the probe on a moving hand during conversation. Option B, apply the sensor over dark nail polish without adjustment. Option C, warm the finger and ensure the sensor is positioned correctly. Option D, ignore the reading because pulse oximetry is optional. The correct answer is option C. Warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 72. While following clinic policy, the medical assistant notes that an EKG tracing has wandering baseline and one electrode is peeling away before the patient leaves the clinic. Which action is best? Option A, leave the electrode loose to avoid discomfort. Option B, write normal on the tracing without review. Option C, tell the patient the heart rhythm is definitely abnormal. Option D, reattach or replace the loose electrode after preparing the skin. The correct answer is option D. Reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 73. During a skills check, the scenario states that orthostatic hypotension is suspected after a patient reports dizziness when standing for a pediatric patient. Which approach is appropriate? Option A, measure temperature in 3 routes. Option B, measure blood pressure and pulse after position changes according to protocol. Option C, take only a single seated blood pressure. Option D, ask the patient to jog briefly before measuring. The correct answer is option B, measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 74. A medical assistant reviews a case where a new patient begins explaining the main reason for the visit while supporting safe patient care. Which item should be captured as the chief concern? Option A, the insurance plan name. Option B, the patient's primary reason for seeking care today. Option C, the brand of exam table used. Option D, the clinic's appointment schedule. The correct answer is option B, the patient's primary reason for seeking care today. The chief concern identifies why the patient came for care and guides the visit workflow. Insurance details, equipment information, and the clinic schedule do not describe the patient's presenting problem. Question 75. For an older adult in an outpatient setting, a blood specimen label is about to be placed on a tube for an older adult. Which action best prevents patient identification errors? Option A, use the room number as the only identifier. Option B, verify 2 identifiers such as full name and date of birth before labeling. Option C, ask another patient to confirm the name. Option D, label the tube after returning to the desk. The correct answer is option B, verify 2 identifiers such as full name and date of birth before labeling. 2 identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 76. While following clinic policy, the medical assistant notes that a provider asks for an apical radial pulse comparison during the visit. Which method is appropriate? Option A, use pulse oximetry only and skip manual counting. Option B, subtract blood pressure from pulse rate. Option C, count radial pulse in the morning and apical pulse later. Option D, have 2 staff members count apical and radial pulses at the same time. The correct answer is option D, have 2 staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 77. When preparing safe patient care, a pulse oximetry reading remains very low after the sensor is repositioned for a returning patient. Which action should the medical assistant take? Option A, delete the result from the record. Option B, tell the patient the reading is definitely normal. Option C, wait until the next appointment to mention it. Option D, report the persistent abnormal reading promptly according to office protocol. The correct answer is option D, report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 78. After confirming the patient's identity, a patient has no known infection listed in the chart. Which infection control approach still applies? Option A, use airborne isolation for every routine visit. Option B, wear sterile gloves for all administrative tasks. Option C, skip hand hygiene when the patient appears healthy. Option D, use standard precautions for every patient encounter. The correct answer is option D, use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 79. In an outpatient medical office, a patient asking for clarification is involved when the medical assistant's hands are visibly soiled after cleaning a spill after the patient asks a follow-up question. Which method is preferred? Option A, wipe hands on a paper towel. Option B, use hand sanitizer only. Option C, put on a second pair of gloves over the soil. Option D, wash with soap and water. The correct answer is option D, wash with soap and water. Soap and water are preferred when hands are visibly soiled because mechanical washing removes material. Sanitizer alone, wiping without washing, or covering soil with gloves does not adequately clean the hands. Question 80. A provider asks for assistance because a patient asks why pulse may be checked before taking a beta blocker for a patient scheduled for a procedure. Which explanation is accurate? Option A, they always raise blood glucose immediately. Option B, they make pulse checks unnecessary. Option C, they are used only as antibiotics. Option D, beta blockers can lower heart rate and blood pressure. The correct answer is option D, beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 81. While following clinic policy, the medical assistant notes that a patient is suspected of having active tuberculosis. Which precaution is most appropriate? Option A, place the patient in the waiting room until closing. Option B, use only clean gloves. Option C, use airborne precautions with appropriate respiratory protection. Option D, ask the patient to remove any mask to speak clearly. The correct answer is option C, use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 82. During a walk-in visit, a reusable surgical instrument must be free of all microorganisms including spores while prioritizing patient safety. Which process is required? Option A, routine dusting. Option B, sanitization only. Option C, sterilization. Option D, plain water rinsing. The correct answer is option C, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 83. For a teen patient in an outpatient setting, instruments are removed from the autoclave after a cycle for a teen patient. Which finding supports that the sterilization process should be reviewed before use? Option A, the package is dry and intact. Option B, the load has a completed log entry. Option C, the chemical indicator has not changed as expected. Option D, the instrument pack is labeled with the date. The correct answer is option C, the chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 84. At the start of a same-day appointment, a disinfectant splashes onto the counter and the medical assistant needs spill guidance. Which resource gives chemical handling information? Option A, Insurance Aging Report. Option B, Safety Data Sheet. Option C, the Appointment Ledger. Option D, Growth Chart. The correct answer is option B, Safety Data Sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 85. In a medical assistant certification review scenario, a finger stick specimen is being collected while checking the chart. Which step is commonly performed after puncture? Option A, touch the collection device to the skin surface repeatedly. Option B, wipe away the first drop of blood if required by the test procedure. Option C, squeeze the finger forcefully until tissue fluid appears. Option D, bandage before collecting the specimen. The correct answer is option B, wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 86. In a medical assistant certification review scenario, a patient reports a severe latex allergy before rooming for a patient who appears anxious. Which action is appropriate? Option A, use powdered latex gloves for a better fit. Option B, use latex-free supplies and alert the care team. Option C, document the allergy only after the visit. Option D, ignore the report unless a rash is visible. The correct answer is option B, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 87. A provider asks for assistance because an employee is assigned to duties with potential blood exposure during a quality control check. Which training is required by safety standards? Option A, retail cashier training only. Option B, bloodborne pathogen training with exposure control procedures. Option C, restaurant menu training. Option D, real estate licensing training. The correct answer is option B, bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 88. For a patient in the exam room in an outpatient setting, multiple tubes including blood cultures are ordered during venipuncture for a patient in the exam room. Which specimen is collected first in the standard order of draw? Option A, red serum tube after all additives. Option B, gray fluoride tube. Option C, lavender EDTA tube. Option D, the blood cultures. The correct answer is option D, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 89. For a patient scheduled for a procedure in an outpatient setting, an insurance plan must approve a medication before it is dispensed. What process is being requested? Option A, alphabetic indexing. Option B, waive scheduling. Option C, coinsurance posting. Option D, prior authorization. The correct answer is option D, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 90. For a patient scheduled for a procedure in an outpatient setting, a chemistry test requires serum rather than whole blood before the patient leaves the clinic. Which specimen type is needed? Option A, a finger stick smear without clotting. Option B, a throat swab placed in urine preservative. Option C, blood mixed continuously with EDTA. Option D, a blood allowed to clot before serum is separated. The correct answer is option D, blood allowed to clot before serum is separated. Serum is the liquid portion obtained after blood clots and is separated from the clot. EDTA whole blood, incorrect swab handling, and an unprocessed finger stick smear do not provide serum. Question 91. After confirming the patient's identity, venipuncture is being performed in the antecubital area for a patient in the exam room. Which insertion technique is generally appropriate? Option A, insert through the vein and redirect repeatedly. Option B, insert parallel under the skin for several inches. Option C, insert bevel down at a 90-degree angle. Option D, insert the needle bevel up at about a 15 to 30-degree angle. The correct answer is option D. Insert the needle bevel up at about a 15 to 30-degree angle. A bevel up 15 to 30-degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 92. For a patient with limited mobility in an outpatient setting, a blood specimen arrives hemolyzed after collection. Which practice helps prevent this problem? Option A, use excessive suction on fragile veins. Option B, force blood through a small needle into the tube. Option C, gently invert tubes according to additive requirements. Option D, shake tubes vigorously to mix faster. The correct answer is option C, gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 93. After confirming the patient's identity, a patient scheduled for a fasting lipid panel says they ate breakfast during a realistic certification question. Which action is best? Option A, collect and label it fasting anyway. Option B, tell the patient to skip water for the rest of the day. Option C, cancel all future appointments. Option D, follow facility policy and notify the provider or lab before collecting if fasting is required. The correct answer is option D. Follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 94. While following clinic policy, the medical assistant notes that an additive tube has just filled during venipuncture for a new patient. Which action is appropriate? Option A, set it aside without mixing. Option B, shake it hard until foam appears. Option C, invert the tube gently the recommended number of times. Option D, open the tube and stir it with a swab. The correct answer is option C. Invert the tube gently the recommended number of times. Additive tubes need gentle inversion to mix blood with the additive and prevent clotting or testing errors. Shaking, failing to mix, or opening tubes creates specimen problems and exposure risk. Question 95. During a skills lab scenario, a patient who appears anxious is involved when a point-of-care test control result is outside the acceptable range. Which action should occur before testing patients? Option A, do not report patient results until the control problem is resolved. Option B, throw away the control log. Option C, continue testing because controls are optional. Option D, change patient results to match expectations. The correct answer is option A. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 96. A medical assistant reviews a case where a urine specimen cannot be tested promptly while preparing for provider review. Which action preserves specimen quality according to policy? Option A, mix it with another patient's specimen. Option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Option C, leave it uncapped at room temperature all day. Option D, place it near a sunny window to keep warm. The correct answer is option B. Refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 97. For a patient with limited mobility in an outpatient setting, a finger stick specimen is being collected for a patient with limited mobility. Which step is commonly performed after puncture? Option A, bandage before collecting the specimen. Option B, touch the collection device to the skin surface repeatedly. Option C, squeeze the finger forcefully until tissue fluid appears. Option D, wipe away the first drop of blood if required by the test procedure. The correct answer is option D. Wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 98. During a skills check, the scenario states that a patient is suspected of having active tuberculosis while preparing for provider review. Which precaution is most appropriate? Option A, use airborne precautions with appropriate respiratory protection. Option B, ask the patient to remove any mask to speak clearly. Option C, place the patient in the waiting room until closing. Option D, use only clean gloves. The correct answer is option A. Use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 99. In a medical assistant certification review scenario, a point-of-care glucose test is about to be performed for an older adult. Which supply check is needed? Option A, wet the strip before inserting it. Option B, use any strip from an unlabeled container. Option C, cut the strip in half to save supplies. Option D, confirm the test strips are not expired and are stored correctly. The correct answer is option D. Confirm the test strips are not expired and are stored correctly. Expired or improperly stored strips may produce inaccurate glucose results. Unlabeled strips, wetting strips, or altering strip size violates testing procedure and quality standards. Question 100. While following clinic policy, the medical assistant notes that a 12-lead EKG is being set up after reviewing the order. Where is lead V1 placed? Option A, on the right wrist beside the limb lead. Option B, second intercostal space at the left midclavicular line. Option C, fifth intercostal space at the left anterior axillary line. Option D, a fourth intercostal space at the right sternal border. The correct answer is option D, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1.